Well, hello, friends. I hope you're having a good week so far. And thank you for tuning in into another episode of Intentional Living with Emlah Podcast. Today's guest is Dr. Jennifer Miller. Thank you for coming on.
It's a true honor. This is the highlight of my week, being with you and being able to share such great knowledge and the knowledge that we share together and helping our community. It is what at least I strive for, and I know you do as well. And to find someone with that similar spark makes the world a better place.
It's so refreshing. It's so refreshing to have women after people taking care of themselves and taking care of other people. I was on Tim Albrich's podcast and he said, Emlah, what is your definition of success? And he took me unawares and I was like, success means taking care of myself and the people around me. He goes, oh, that's powerful. And then since then I've stuck with that. Yeah. And I find that in you. And I would like to introduce you to my guests so they know the level of greatness with which I'm sitting. And I was like, I need to have you on the podcast because I cannot keep this greatness all to myself.
Oh, that's so kind.
Your connection between science and service and intentional living is what makes me get drawn to you. You are a dentist with a passion that goes far beyond teeth. So when you think of a dentist, it's teeth. But she's a Dublin native and a graduate of Dublin Kaufman High School. Yes. So all the graduates of Dublin Kaufman High School, share this episode with your friends. She is one of yours. She went on to earn a degree in Miami University before pursuing her Doctor of Dental Surgery at NYU. So Miami University, then you went all the way to New York and then continued advanced training with a trauma residency at New York Medical College. You just stayed in New York for an implant fellowship at Ohio State University. You came back. Yes. So after Miami, you went to NYU, New York, and then back to Go Bucks.
Absolutely.
But what makes you truly special is your commitment to whole person health. And that's where we connect because you are deeply passionate about oral systemic connection. And we talked a little bit about that. And I can't wait to share this with our audience today. You're helping patients understand that what's happening in their mouth connects everything with cardiovascular health to inflammation to overall well-being. But not only that, what touches me the most as somebody who originated from Cameroon, West Africa, Central Africa, you are a global change maker. And the fact that you serve on the board of Free to Smile Foundation, where you have provided life-changing cleft lip and dental care to children all over the world, it just makes it, you are at the intersection of dentistry and intentional living. And I cannot thank you enough.
Oh,
it
means so much to just hear it from you.
This is you.
And we all have the chance to make an amazing impact on others, whether we're here or around the world. It's finding the passion to do it. And it's something that I just have become really close with, that I love to do. I think human nature and human beings and the human story.
Yes.
And that we're all connected. And we have the ability to heal and help each other. I think I'm a natural born healer and helper.
You are.
But to do that in many places is an honor for me.
I was going to ask you, what made you decide to do dentistry? What pulled you into dentistry?
I think my mom was such a huge influence in my life.
Hi, Mama.
Yes. I mean, everyone that knows her loves her. And
yes.
She is someone I truly have always looked up to. But her passion, again, for people and health and bringing people to a better level is just her. And I got to see that my entire life. And her impact on patients was something I think I was drawn to. I love the science and I love the art of dentistry. But the person behind that smile is, I think, where my passion really lies. I'm lucky to have, great hands and good skill, and I love that I can do dentistry well, but making people healthier and bringing people together is my favorite part.
I love that you go far beyond the teeth, because when we think about dentists, the natural thing is like, oh my gosh, I'm scared of dentists.
Yeah.
It's impossible to be scared of you. Because I'm like, oh, so
thank you.
But from the trauma part of people generally being scared of your profession, what do you say to people? Like, how can we relieve that? How can we start to rethink that trauma?
I think the most important thing, which I tell patients and people all the time, is getting your kids to the dentist early and having a great experience, because children remember things for a lifetime. And if a child has a great experience when they're little and they're excited about their teeth, if you teach them just a few things, they're like little sponges. And we do a lot in the office to really have fun with the kids. I orient them all to become dentists themselves, so I have backups. But they're so cute and they're so fun. And then the parents feel like, oh gosh, if I go to the dentist without them, they're going to be mad at me, which is a great thing, because they want to come. So the stories you hear in adults about being scared, it always goes back to an experience when they were little. And they never forget that. So for me, it's ingraining in early, because it's harder to reverse from a bad situation instead of pushing a child into a great positive direction to be healthy from the beginning.
Oh my gosh. And I absolutely love what you have done with your practice. It feels like a spa in there. I didn't want to get out. She had to kick me out. She was like, I think we're done for the day. It's time to go. It is beautiful. It is relaxing. It is... I didn't feel like I was at a dentist's office.
And that was my goal with my office. I've been in a lot of dental offices, and there can be a strange smell and a very sterile feel, and that is scary alone. And I was like, I'm going to be here all the time. This has got to feel like my home. And I hope that it feels like our patients' home too. So a lot of times we have, swag that says home on it with a shamrock, because
I saw that.
I truly want it to feel like that.
It does.
And I think it does have a special feel, and there's a lot of awesome positive things that go on there that it feels like a great home.
I love that. So tell me, what age should parents or caregivers schedule their first dental appointment for their baby?
Parents know they can see teeth very early on in a child's life, but every child should have a dental home by age 1. So that is so we can teach the parents about nutrition and what to look for, and how to, by age 2, a child will have 20 teeth. That's a lot of teeth to take care of. And if you can imagine maybe a 3-year-old with cavities, that's the worst start you could have. So if you get that beginning to be healthy and strong and train the parents, because sometimes it's just education. You just need a couple little pearls to get these kids on the right track, even how to brush their teeth, what positions to put them in, what kind of things to do. Like after they have milk, they should have water, how to get a little toothbrush in their mouth. But it's just, the kids are so smart, and they grab onto things very early. So if you start these things early, it's never going to be something new for them. It's just going to be what they do.
I love it. You heard Dr. Miller, and she said before you celebrate that first birthday party, make sure you make that dentist appointment for your baby.
It's a great idea.
I think that's a great one to say. So before you start making preparations for that birthday party, make sure that your baby sees a dentist, because it's difficult to reverse, but it's easier to set them. This is why we talk about prevention. This is why we talk about whole person health. We want to put them on the right track. This is what we want for all our children and for ourselves. As they are growing older, what are some habits that we should instill in children? We know we talk about we're brushing our teeth every day, we're flossing and all the things. How do we make these truly actionable items? Because as they become teenagers, those tend to drop before we get to young adults.
We're lucky in dentistry. We have a lot of toys and tools to use that are fun for kids, even for adults. So now electric toothbrushes that give us an idea of how long to brush. And we call them squirt guns for the teeth, but water picks, which adults love too, but their kids steal them from them because they think they're fun. Like, this makes it so much easier. The flossing, obviously, there's a lot of great flossers and floss tools that you can use. But I think the bigger thing is not telling people, okay, you have to do this. The why. Why are we doing this? Okay, we're eating food. Things are getting stuck in our teeth. Our mouth is just this area of so much bacteria, which is trying to get into our bodies, which causes a lot of inflammation. And now with all the research that we have, it's not just the teeth. It's not just the mouth. We can see what's going on in the body from your mouth. But we can also influence our body from our mouth. So if we keep our mouths cleaner and do a few things to change, our bodies will thank us for that.
Oh, without question.
Sometimes that's hard to explain to a child, but it's just giving them the right tools, having them watch maybe a brother or sister or their parent do it, then they want to do it too, right? So it's really getting those routines started early. And then introducing the why to them over time.
Speaking about the why, I say, what happens in Vegas stays in Vegas, but what happens in the mouth doesn't stay in the mouth.
Exactly.
It goes down to the whole body, the heart and all the systems in the body. So this oral systemic connection, very powerful, but we have not talked about it enough in healthcare. Tell us a little bit, give us an introduction to the bacteria in our mouth, the oral microbiome, and how important that is in preventing inflammation and things like that.
People, we talk about gut health.
Yes.
And the gut microbiome and how that's influencing so many things like your immune system.
100%.
Things we weren't really thinking about previously. So the mouth has an oral microbiome as well.
Mm-hmm.
And this whole tube is connected.
Yes.
So the bacteria in our mouth is obviously getting into our bloodstream. That's where we have to put our heads. The pH in our mouths needs to stay very neutral. Unfortunately, we have all of these things on the market that kids are drinking, adults are drinking that are very acidic. Things from even like a bubbly water.
Mm-hmm.
The flavorings in those artificial flavorings are citric acid. So
hold on. She mentioned bubbly water. She mentioned bubbly water. So this is what we've been doing. We have been marketing, soda, all the pops and everything. We're like, oh my gosh, that contains 20, 30, 40 grams of sugar. Let's drop out on that. Let's drink bubbly water. Right. That's better for your health. So you're telling me
this could be a dangerous starting point because most consumers think water is water.
Yeah.
And we need to continue looking at ingredients. Look at what you're drinking. What are you putting in your body? I mean, it's a good mindset to have no matter what we're consuming. But the acidity changes the oral microbiome. And the other thing we talk to patients, okay, let's think about mouth rinse as well. What are we doing to the mouth? Well, the important thing about the mouth to know is we create nitric oxide in our mouth.
Yes.
Nitric oxide is a very powerful thing for our body. It opens our arteries and veins. It allows us to oxygenate. When you get rid of that nitric oxide, the research is showing you actually will increase your blood pressure. So these connections start to make sense as we see, people with high blood pressure or heart disease, these people are actually building more calculus in their mouth. They're using mouth rinses rampantly. It's not helping. So we need to reverse that thought. We need to take care of the bacteria first. How can we even out the microbiome and keep it a healthy environment so your body can react and heal you better? You
guys need to see my face right now. I'm sitting here thinking, what is my next question to her? Am I going to ask her about the bubbly water that we've been drinking so much and messing up our oral microbiome? Or should I go into the mouthwash and Listerine, which that one I know, but every time I sit down with her, I learn something new. I was going to ask her about all this mouthwash and all the Listerine, which I was like, don't get me started on that. But let's start on that. I'm going to hold my questions on the bubbly water because I'm a fan. Dang it.
But there are tricks. I'll teach you.
I want to know. Well, you know what? Let's hold the mouthwash first. Teach me the tricks.
So, you need to know about the things you're putting in your body.
Yes.
But let's think about pouring acid on your teeth.
Ooh.
So enamel is the hardest thing in your body, but you're starting to open up the tubules in your teeth so bacteria can get in. Acidic things, I talk to patients, if you have a true addiction to something that you love and you want to have it, use a straw. A straw helps to bypass your teeth, helps it so it doesn't sit so much on your teeth. And then after that special treat, have water, swish, neutralize out the acid. So those are things you can incorporate that aren't like you can still give yourself the treat and not feel so bad.
This is why it's good to have smart friends, guys. So you can use a straw and bypass pouring acid on the enamel of your teeth. So if you have to drink your bubbly, that way you know. So because bubbly does just as much damage to the teeth as soda will do. So what we want to do after we use the straw, she said we should drink water, swish and spit, swish and rinse, or swish and swallow its water, and we're good to go.
Exactly.
Oh my goodness. The advantages of having smart friends, people. And now let's talk about this mouthwash.
So the research is showing, okay, if you have an alcoholic mouth rinse, so something that's very burning in your mouth, you think, oh yeah, it's doing something good. It's not. So if you think of it kind of like an antibiotic, an antibiotic is going to kill good and bad bacteria.
Yes.
Right? So you're throwing off the balance. Like, so whenever I put someone on an antibiotic, I say, okay, you need to have yogurt with this or a probiotic daily. We need to keep your gut.
This is why I love you.
It's so true, but it's the same in the mouth.
Yes.
So you wouldn't prescribe an antibiotic for somebody every day.
No.
That would completely throw them. They'd end up with C. diff and they wouldn't make it.
Yes.
So why are we doing that in the mouth? The alcohol is drying the mouth. It's also getting rid of good bacteria. So bacteria is building more. And these patients are using the rinses more often.
Every day, 2 times a day.
Can't. So the best thing if you need to rinse is a warm saltwater rinse. Very cleansing, but it's not killing the good bacteria. But really the basis of keeping your gut and mouth at an even pH is just to do the work. Eat well.
Yes.
Eat nutritious things.
Yes.
And also brush and floss and keep your mouth happy. You don't need to add in all of the things.
Yes. So it's not all the extras. It's not all the gadgets and things we buy. Get a good toothbrush, brush your teeth, but then you put nutrient-dense foods on your plate as close to nature as possible, minimizing the acid. And then we floss and we don't use the mouthwash that contains alcohol.
Yes. You got to stay away from that.
Yes, we got to stay away. So take a look at your mouthwash. If you're listening to this podcast right now, pause, go to the bathroom, take a look at your mouthwash. If it contains alcohol, put it in the trash.
Yes.
That's what Dr. Miller said. And I really stand by this because we don't want to continuously put those small doses of alcohol in our mouth. It's killing our oral bacteria and it's there for good. It's supposed to take care of us.
I love to read research. I love to see what,
the
newest data is. That's kind of what keeps me excited about growing and learning and helping people the best I can.
This is why I love you.
But it's exciting. It makes dentistry fun. It makes health fun. But there was a study, they took healthy 20-year-olds, girls and boys, with normal blood pressure and had them swish with an alcoholic mouth rinse twice a day. And they induced hypertension in those 20-year-olds. That was what kind of got me.
I saw that article on Open Evidence.
Yes.
And I was like, oh my goodness.
It hits you hard.
Is this real? Like I looked at it, I was like, what is going on here? High blood pressure from mouthwash.
And then we talk about this too. I mean, what is a healthy blood pressure? And we take blood pressure in the office.
Yes.
So 120 over 80 now is considered prehypertensive.
Yes,
right?
yes.
So as you creep up over that, your physician is going to start to talk to you about that. They're probably not going to ask you about mouth rinse.
No.
And even if you're just slightly over, they start to talk to you about medication.
Yes.
And we always talk about
they'll start you on lisinopril or losartan. Yes, we're trying to get people off medication.
So these are little things that you can do to try to help yourself stay in a healthy range without becoming medicated. Because once you're medicated, there are always side effects. So for me as a dentist, then these patients come to me, they have dry mouth from many of these medications. Okay, now we have to go back to the oral microbiome because now your mouth is not, and you're frustrated that you're getting cavities or periodontal disease.
Yes.
Which is, again, affecting your whole overall health. So it's trying to make little adjustments. And you talk about intentional living.
Oh
and
my goodness,
I thought about this a lot. And I know people talk about balance a lot, but I think it's about little adjustments over time, looking at yourself and knowing yourself.
Yes.
And knowing when things don't feel right. And if they don't feel right, it is great having awesome friends with great knowledge. Ask for help or look for education to help you make small changes. I know change is difficult.
Yes.
But sometimes when it's like, oh, it's as easy as getting a water pick or it's as easy as not using mouth rinse, those are things you can add in to your everyday.
These are basic, small. I talk about, this is so refreshing to talk with somebody who gets me. You speak my language. It's small, consistent steps in the direction of your goals, in the direction of your dreams. Our dreams aspire to lead a fulfilled life, to lead an intentional life. And an intentional life, part of it is not including blood pressure, high blood pressure and high blood pressure medications. Because the guidelines, if you start with lisinopril or losartan or hydrochlorothiazide, they keep adding. If it's not controlled, we add this. If it's not controlled, we add this. If it's not controlled, we add this. And as we're adding and stacking on, the side effects are increasing.
Yeah.
The dry mouth, the dizziness, all the things are increasing. And there's none of that part in a fulfilled life that includes dizziness, drowsiness, and a dry mouth.
Because when you're healthy, you see the whole world and you can help so many people.
I know.
But when you have a disease, your world becomes so small. You're so focused
defined by
on
that.
one thing. So it makes sense to
you're making me emotional.
You know?
Yeah.
You know it. I know because you practice this and that's what's so cool to have great friends that
it's important.
You.
It's important. I love the way you said you will not prescribe an antibiotic to a patient to take every single day. There are rare situations that is needed in the medical world, but we give people antibiotics to take every single day. And for those patients, I absolutely make sure that they are on a probiotic every single day going forward if they have to take an antibiotic for a medical reason. I make sure that they're on a probiotic because when the antibiotic goes, it kills the good and the bad.
Yeah.
It kills the good, the bad, the ugly.
Balance is off.
So the balance is off. And once the balance is off, your mood is messed up.
Everything.
Your cardiovascular health is at risk. Your gut health is at risk. Your immune system is at risk. Inflammation drives up. And you talked about nitric oxide. There's something that we don't talk about. And when she said nitric oxide, it opens up our blood vessels. It's called a vasodilator. So it opens up our blood vessels. And when those blood vessels are nice and open, your blood pressure is lower.
Yeah.
It doesn't stress your arteries in the body.
Exactly.
So do us a favor after listening to this podcast today, in addition to sharing it with somebody who you think will benefit from, stop in your bathroom and check the label on your mouthwash and see if you need to put it in the trash. If it contains any alcohol, put it in the trash. And Dr. Miller says a salt water rinse is just as good, if not better.
It's so cheap.
I know, so affordable.
Yes.
Just a little bit of salt and a little bit and water.
Yes.
And you gargle. So we brush, we floss, and if we need to gargle and rinse with salt water.
Well, and the other big thing this past year, we found out is the influence of the oral bacteria in connection with Alzheimer's.
Oh my goodness.
And I think this is a really big one that hits people hard. You know, I'm not a physician asking my patients to exercise for 30 minutes a day. If you can make one small change to floss and keep your mouth healthy, we know that there is a very common oral bacteria that is able to cross the blood-brain barrier and is killing brain cells in Alzheimer's patients. So when you could spend an extra minute a day, and especially if you have a history or genetic link to Alzheimer's, this is something you want to do. And I think it's inspiring. We love our teeth.
Yes.
And even if you don't, I don't think anyone wants Alzheimer's.
No.
So if you can make a small change, and that's not a big one, you are influencing your health long term. That I always talk to my patients about, Alzheimer's is a disease that is manifesting early and shows up later. And so we need to start early and we need to start now, just incorporating some good healthy habits, and you're keeping yourself away from bad things. That's a powerful thing that you can do.
This podcast is sponsored by Journeys, your path to intentional wellness. Most health problems don't start overnight, and neither does wellness. With Journeys, you can take charge of your health before you have to. Every cell in your body is speaking to you. But when we ignore preventive medicine, we wait until those cells are screaming. Journeys helps you listen to the whispers. There are 3 different journeys to choose from, each designed to meet you where you are in your wellness path. The Core Wellness Journey for $199 offers a foundational look at your overall health, perfect for getting started and measuring 66 biomarkers. The Advanced Heart and Metabolic Health Journey for $339 measures 111 biomarkers and goes deeper into cardiovascular, metabolic, and thyroid health for a more detailed picture. The Comprehensive Longevity and Hormone Journey costs $469 and is the most complete view, including hormone, nutrient markers that support energy, balance, and healthy aging. This measures 120 biomarkers. Each journey includes a personalized recommendation, one-on-one care from your pharmacist, and follow-up support to help you turn results into lasting intentional change. You just won't get data. You'll get guidance, accountability, and a partner in your wellness journey. Intentional living means paying attention, staying curious, and taking steps towards the health you deserve. Start your journeys today. Click the link in the show notes. You just triggered an emotion for me there, because just last week, a friend of mine lost her husband, and he was not yet 60. Lost her husband to early onset dementia. He's had Alzheimer's and he's gone downhill.
Yeah.
So thinking about this, there's nobody who desires that. And in addition to that physical activity, because our pillars of intentional living, nutrition, movement, we can make small intentional changes. And this small intentional change Dr. Miller is telling us about today is literally 1 minute.
Yeah.
1 minute of flossing
Exactly.
is able to help us prevent the growth of bad bacteria in our mouth that can stimulate and precipitate and increase the early onset dementia.
Exactly. That's powerful knowledge.
So you're telling me that flossing, and this is the thing when I told my friends, I said, you know what, I did the genetic testing, because we do it at a pharmacy, genetic testing for the ApoE genes, homocysteine and all the things. And they're like, Emlah, do you want to know? I go, absolutely, I want to know. Knowledge is power.
Yes.
If I know that I have that genetic variant, guess what I'm going to do? I'm going to be flossing every single day, because when people see data, they're convinced. Yeah. All of us have a little scientist in us, even if we don't accept it.
Yeah.
And I love that aspect. So I will put a link in the show notes to that article that Dr. Miller talked about the blood pressure article that they induced blood pressure with the Listerine for those college students. Yeah. I'll put a link to your practice as well. And I can't even thank you enough. Like, just the things that I learned from sitting with you. We've talked about the link to dementia. We've talked about the link to just the gut health. I want you to mention a little bit about the link to cardiovascular health, heart health, and the teeth.
We've known for a long time.
Yes.
And what I tell patients, I say, think about this. Your cardiologist won't do surgery on you. Your orthopedic surgeon won't do surgery on you until they get a dental clearance from me.
Why so?
Why? Because they know their surgery is much more successful without extra inflammation and oral bacteria in the body. So what you are doing with your mouth is going to influence how your body heals. I think that's the biggest light bulb moment for a lot of patients. And they're like, even cancer patients, to go on a bisphosphonate. We're all trying to work together to help our patients the most and have the most successful outcomes. But we've known these connections between the heart for a long time, and having extra research on nitric oxide and what's happening in our mouths. But this is all connected. I think we have to remember that. I think for a long time, people were disconnecting the mouth from the body.
Yes.
And now that we have so much knowledge and so much science, and really the small changes that we have to make, I just say, see your dentist. Make sure you're being educated at your dentist. I told you before, going to the dentist is not a car wash.
No.
You should not be in and out of there. The power of going to the dentist is learning something new. Your provider should be helping you understand your overall health. And it's very powerful things. I mean, we look at kids when they're little and adults with it. We even talk about sleep apnea and airway. There's a lot that we see, especially in a position in the dentist's office, and
you're lying down
and the airway and sleep, and many people don't go to the physician very often. So we are in this powerful position to really change and save lives. It's an awesome part about being a dentist. It makes me feel like I'm really, really helping people with their overall health, and I just love it, because they, like kids, adults want to learn too.
Yes.
We're not done yet.
I tell my clients, I have yet to meet somebody who wants to jeopardize their health. Everybody wants to do well. But this is the thing. I was not at Miami University with her. I was not in dental school at NYU with her. And I was not in residency with her. I was not at her fellowship at Ohio State. So What can I do as a friend? What can I do as a patient? Learn some of this knowledge that she's got all this knowledge in her head. But what can I learn from her that's going to make me lead a better life? What can I learn from my dentist that's going to make my life more intentional? And we've heard today from her about the connection with oral health and cardiovascular disease, oral health and Alzheimer's, oral health and inflammation, systemic inflammation in the whole body, and what we can do. Small things. Well, I've asked you a few questions, but I have some questions that I'm dying to ask you about the connection of dental health and sleep. You're able to diagnose this thing because when I come to the dentist, I'm lying down with my mouth open. You're able to see my airways.
Yeah.
What do you see that tells us about sleep?
Well, my starting point is looking at a patient's health history and their medications.
Yes.
So if I see that someone is on, medications for hypertension, high blood pressure, and they tell me they don't sleep well
Yes.
and they're snoring, there's a little light bulb that goes off.
Yes.
Sleep is so important for healing and regeneration. And if we're not sleeping, that is one thing you need to hone in on. And try to make some changes because your body will work better no matter what. We all know that. But we all kind of get accustomed to how we sleep and we just think that's what we get. But we have the chance to make it better and it can be influenced by many things. I ask many questions about medications, obviously, but then we are able to assess the airway and ask patients about sleep. Have you had a sleep study? We're so lucky now that you can do an at-home sleep study so easily. It can be sent to your home.
Yes.
Like people were very scared to go to a facility, be strapped up to many
Yes.
leads. And is that replicating good sleep? I don't think so, personally.
Yes.
But it's a little bit easier for someone to get an at-home sleep study and just get a baseline knowledge of how you're sleeping. And then we can do things. I mean, many people don't want to be on a CPAP, but there is a very great option of having an oral sleep device that can start by having you or your spouse not snoring. That can help with sleep, but it also opens the airway. Patients love to travel with an oral sleep device rather than a CPAP.
Yes.
And for patients with mild to moderate sleep apnea, that's an option. And so people's eyes open big, like, oh, I could be better. I could feel better. We have got many patients off their blood pressure medication just by helping them sleep better. Sleep also relates to your cortisol levels, our stress hormones, and so if we can reduce those, your body works better too. People aren't thinking, oh, the dentist is going to see all of this, but we have the information right in front of us.
And sometimes you're able to see it before the sleep doctor because people just tend to accept the normal and be like, this is just how it is. I have a difficult time sleeping and this is my norm.
Yes. And then it relates to kids too. We have so many kids with ADHD and anxiety. Well, let's look at their airway. Are they breathing? Is this child clenching and grinding? Are they trying to move their jaw around at night to breathe? Usually, 5-year-old isn't super stressed yet, we hope, but it's usually a sign of them trying to breathe at night when their teeth are ground down. So can we send them to an ENT and have those tonsils and adenoids evaluated? Yes. And can they be removed early? Yes. And all of a sudden, the anxiety, depression, ADHD, many times will go away. So it's like, okay, let's look at the source. Let's try to find the root problem and not just start medicating everyone. I know you're a pharmacist and we love drugs to be powerful for the right reasons.
Oh, I know.
But we can't just keep throwing drugs at people.
But this is what I do. My goal is our tagline at the pharmacy is there's a lot more to health than prescriptions. A lot more to health than prescriptions. Listen to what Dr. Miller just said. She connected your oral health to stress levels, to cortisol levels, to sleep levels. If you can take care of that. And if we're not taking care of these, down the line, 10, 20, 30 years down the line, we're looking at early onset dementia because with that sleep apnea, we're not sending oxygen to the brain. Exactly. And that's something could have started very early. And then we're using the mouthwash and killing our good microbiome, and all of these things are connected. I just want to, if you get nothing from this podcast, just get the fact that sincere and intentional oral care can affect your health in a myriad of ways for the better. And it doesn't have to be a prolonged effort and stressful. It could be as little as 1 minute of flossing. 1 minute of flossing, and she called them. We have all the toys and tools and all kinds of floss, all the different colors, and it doesn't have to be mouthwash that has alcohol.
Exactly. Yeah, it's exciting.
I love that. I love how you make it so simple and so basic, and it's something that we all want to do. I have a question for you. We hear a word thrown around very commonly, and people have no idea what it is and what we can do about it. What is TMJ? Can you school us?
Yes. So the temporomandibular joint.
Oh, hold on.
TMJ.
Say that
It's
one more
so
time.
long. That's why we abbreviate it.
Yes.
Temporomandibular joint.
Temporomandibular joint.
Exactly.
All right.
TMJ. So it's actually a joint.
Mhm.
Now you'll hear TMD, temporomandibular disorder.
Yes.
So every joint should work properly. Your knees, your hips, your
Yes.
elbows, they have a nice buffer joint to help them move in a rounded form.
Mhm.
But as we are aggressive with those joints, obviously runners or athletes know that our joints can wear and tear over time, just like our TMJ. So if we're a clencher or a grinder, or we're on medications that cause us to clench and grind over time, you'll wear that joint. And so people feel like, oh, there's something wrong with my ear. And my good friends at Ohio ENT send me a lot of patients that they say their ears are fine. Can you please help them with their TMJ joint? So we see the clenching, the grinding, what those effects do. So people are clicking and popping and in pain and have headaches and migraines, all because they're overusing this joint. Now, a lot of people, it comes back to their sleep, because if you're trying to breathe at night and moving around for 6 to 8 hours, I tell patients, if you went to the gym for 6 to 8 hours every day, all of your joints would be doing this.
I never thought about it that way.
Exactly. So same thing like an athlete. You're producing inflammation, you're producing lactic acid. And the tough thing about healing in that area is we chew and we
Constantly.
talk, and you're asking something to heal that you're using
All the
so
time.
it manifests for so long, and people get so frustrated. How do we make this better? So we use a lot of tools. I really try to do things as natural and holistically as possible. So I use a lot of turmeric for anti-inflammation.
Yes.
We also use Botox in the practice
Yes.
as well to calm those muscles down for a period of time so
Yes.
they can heal. And also assessing the airway, seeing if it's a sleep issue or seeing if it's another disorder where you're stress, clenching, or grinding. And we treat it that way with either a sleep appliance or a guard to wear when you sleep. So when you start bringing the inflammation down, then all of a sudden your ears feel better.
You feel
the
better.
ringing goes away. The
Migraines
tinnitus goes away.
go
The
away.
migraines go away. And people feel like they're getting their life back, which is a big deal.
I love that. I love that your perspective on dental care is whole person health, whole person care. You step back and you take a look not just at the mouth, but you take a look at the entire whole person. And this is intentional living. This is what brings you joy. And the passion with which you talk when you talk about dentistry, I just sit here and I'm enjoying you. Sometimes I get lost and I'm like, oh, because of how much you care.
I love it.
And one more question. If somebody wants to, would you share with us the link for your global foundation so that way, if somebody wants to join or help?
So I'm involved with a local organization called Free to Smile Foundation. That was founded almost 20 years ago here in Columbus.
Yes.
And we work with oral surgeons, dentists, nurses, ENTs, and we provide cleft lip and palate care and also dentistry for kids in need around the world. And it's been one of the joys of my life to be able to travel and meet such passionate people that have just a heart to help and want to create a team environment where we're able to do that in such a comprehensive way. So again, I love this organization because we're not just looking at somebody's face, we're looking at the whole child. And that's where my heart is always, this.
I love that. I love that you're able to go and do this and it brings you joy, and then you're able to take that joy and bring back to your practice.
And you hear the stories. It makes me a better
human. And the
human.
pictures, yes.
These are kids that are struggling they just want to go to school. Like we take that for granted. They don't get to shower every week or take a bath. They travel for days to get to us to have surgery or dental care. The profound impact that you can make. And I truly believe one person can make a difference. And when you help this one person, what are they going to be able to do? It's awesome to go back and see what happens after you're there and treat these kids over many years. And it's pretty awesome. So if any nurses or speech pathologists or even someone that just likes to help administrative people or dentists, freetosmile.org is our website.
We will put that in the show notes. We'll put Free to Smile in the show notes. So if anybody would like to volunteer, any healthcare providers out there would like to join, and that will be a wonderful way to give back and improve.
And I'm so lucky in my office. I put a lot of these kids' pictures up, and I think it's a great way to have perspective on. We're so lucky, but also we also all have the chance to help another human being. And patients ask me all the time, I don't know if I could travel to another country and do this type of work. So I'm supporting you, and my patients are so supportive of me. My family is so supportive of me. But I just tell my patients every day, it's nothing big that you have to do. You can just help your neighbor. You can help a friend. You can look beyond yourself in just a small way, and that makes our world a better place.
I love that.
And if more of us could do that, I mean, the power of that is just...
This is intentional living. This is intentional living. Well, friends, this is one of my favorite segments of the podcast. It is Supplement School with Emlah. And don't worry, there's no exam at the end of this school class session today. But I'm going to ask you a difficult question. And I know this is difficult because I know I have an idea of the supplements that you take. So I'm going to ask you a question. Name the supplements that you take kind of daily, but if we were going on a trip and I said you can only bring one supplement with you, what are you going to bring? And that's what we're going to talk about today. Ooh.
You know, I want to say one thing. I am very lucky to have an awesome family.
Yes.
My mom and dad are one of a kind and so supportive, and the reason I am who I am.
Well, mom and dad, shout out to you guys.
Shout out to them.
Thank you for raising an awesome daughter and an awesome dentist to us all.
And also my sister, who is, she was a Division I athlete and runner, and she coaches at Northwestern. And
kudos to her.
She is all about health and keeping her athletes healthy. And she's also has a science mind. So we're always in this together. And like you said, it's always fun to have friends that goes back and forth and look at the science and what is it showing? And then how can I help my patients because I know more, right?
Yes.
So I have to be healthy also to help health.
That's success.
That's always my goal. Like,
take care of yourself first and then you take care of us.
I want to be a good role model. I mean, a good representative of health. So I'm always trying. Am I perfect all the time? No, but I try. But she taught me a lot in this past year about creatine.
Yes.
And I mean, it is mind-blowing when you delve into it about, especially for women, but really across the board, lean muscle health. I mean, there was a big push of it. And when I was in high school, about all the boys were taking creatine for muscle. But really, it's about lean muscle, keeping your bone health strong. But beyond that, the data on your brain and creatine. So I think for me, if you said I was traveling, you don't sleep as well. But they show that if you take a certain amount of creatine, you can battle the effects of sleep deprivation. They're also doing research and dementia and
100%.
And I'm like, this is mind-blowing. I can put a little bit of this creatine in my tea or my coffee every day, and they show how that builds in your system. And then you can see and feel the effects of it.
Without question.
That's a wow.
Without question. And I go back to the fact that, I always tell my clients muscle is the currency for our future. Exactly. Anything that can help us build muscle is one that we want to be putting in our 401k.
Yeah.
Because you're putting money in your 401k, you got to put muscle on your body to be able to live that long, fun life that you're dreaming and hoping to live. And we're going out. One of our pillars of intentional living is movement. So whenever you're working out, if you're able to take 5 grams, just 5 grams of creatine monohydrate, the most bioavailable, the one that your body can absorb well and use easily, is creatine monohydrate. So we're going to put a link in the show notes to the Emlah Naturals creatine. 1 little scoop, 5 grams of creatine monohydrate, that will be wonderful.
And I want to tell the listeners as well the importance of getting good quality supplements.
Oh, yes.
A very hot topic.
Near and dear to my heart.
And we need to make patients and people aware, just getting a supplement on Amazon doesn't mean you're actually getting the supplement. Vitamins are not regulated in our country. We need to know that. So you do need to be intentional about where you are buying your vitamins and knowing they're third-party tested and knowing you are putting something in your body that is good for you. So going back to Emlah, I mean, she's promoting good supplements, and that is a very important part of it.
I did not pay her to say that. I did not pay her to say that.
believe
Your
it.
supplements and vitamins, if you're putting something in your body, it is your body. You don't want to put something in your body that's going to burden your liver to be cleansing out all the impurities. Take supplements that are pharmaceutical grade, that are third-party tested. And this is the reason why I created Emlah Naturals, to vet it all for you, so that the supplements that I'm putting on Emlah Naturals are things that I will put in my own body. After years and tens of years of studies on supplements, this is what I know. They're in a facility that where they're created, where we do third-party testing, and they're making sure that they're sourced appropriately and sustainably. And so don't just get on Amazon, TikTok, and Instagram and just buy any creatine there because you saw somebody promoting it. Make sure your supplements are third-party tested.
Exactly.
Yes, so
Very
creatine,
important.
and then the salt form too. So there's creatine out there, but you want to make sure that the one that if you have creatine at home, take a look at the bottle, make sure, look at the back, it's creatine monohydrate. If it's not, stop by the pharmacy, or we'll put a link on there to buy ours. And that creatine is not only helping you build muscle, it's also helping prevent that cognitive decline. It's helping. There are several benefits of creatine, which are listed. I'll put a link to the monograph. It's just a one page, don't worry. But for those who have love science, I have some peer-reviewed articles that I attached to the bottom for
I love it.
for the people that nerd out and stuff like that. So I do appreciate you. And I just, I was going to ask you, like, if you have an intentional initiative, one thing that we could do, but I feel like you already told us that. 1 minute of flossing.
Easy. Or water pick, anything to disrupt that bacteria. It's going to make me happy, and it's going to affect your health long term.
We need to make Dr. Miller happy, and the only way she's going to be happy is if we are able
Keep
to
me smiling.
improve our cognitive health, improve our dental health, and improve our whole system health. And she thinks that there's one thing you could do, and that is flossing. You could floss and not use mouthwash that has alcohol in it.
The other thing I would throw in possibly is a
Yes.
probiotic.
Oh, yes.
Without
without question.
Skip out on that.
And we're not skipping out on probiotics. We're not, because we've talked about oral microbiome.
Exactly.
We've talked about all the importance of the good bacteria. The good bacteria does more for us than any other organ in our body. Like, there are billions of them, and that's what they do for us. I appreciate you. Thank you for coming on this podcast today. And every time I sit with you, I learn something new. Dan, I want to thank Dan for connecting us, because without him, I would never have met you. And I am so grateful that he connected us.
I think that's also a part of intentional living. And I was talking
Positive
about
social connections.
Yes, I mean, Dan McClurg has been my patient and friend for many, many years, and he knows so many great people, and we all do. But I wanted to meet you for so long, and he just says, "I have this great person you have to know," and I was like, "Oh my gosh, I can't." And then it was like this light bulb moment. It's having people in your corner, people that are supporting you, and we're all pushing ourselves to be better and brighter, and also educating our friends. And
I love that. Every time you speak, I'm able to extract a pillar of intentional living. Again, the pillars of intentional living are nutrition, movement, inner alignment, and positive social connections. And you embody that in all of the ways. And during this podcast, we have jumped around all those pillars, and we've just put them together nicely. I want to thank our listeners for listening to this podcast. Do me a favor, share this podcast. I know there's valuable information in here. Share this podcast with anybody in your life who has teeth. That is everybody.
Yeah, and I'm happy to answer any questions.
That is
Reach
everybody.
out. I mean, knowledge is power, and put good people in your corner to help you be healthy. And we're here, and we want to be here for you.
Thank you. And I'm putting a link in the show notes to Dr. Miller's practice. And if you want an awesome dentist in your life, that's who you should be reaching out to. Thank you very much, and continue to live each day with intention.
Thank you.